78 years old, been in a chiropractor for 40 some years. And I don't know how much you want me to tell you on, but let me tell you what's happened. We have a stem cell clinic and we've been in injection for about 3 years in Arizona. We do RERP and all these kinds of things. And of course, Karen introduced us to the wife Lab about 6 weeks ago, and she showed up at my door on a day I was off and I was getting ready to leave. And I told the good Lord got us together because she was banging on my door and I opened it and there she was. So anyhow, my story, I've had stem cell injections, live stem cell in my knee twice, which has helped, of course, and it's costly. And since I've been using the patches, of course, gosh, so much has changed. My liver spots, as they call them, are half what they was. I can lift 30% more at the weights at the Lifetime Fitness. I go there. I've been going there for years. And I have way less stiffness afterwards. I have more energy, of course. Gosh, what else? Sleep better. It just all around, everything's improving. And I've seen patients get so much better with this. I do the activator protocol, which is a special protocol in chiropractic that we test each individual joint in the spine before we adjust it. And of course, our reactions on patients that are coming in that are starting to use the LifeWave patches at 39, of course, is less and less and less. So I'm seeing improvement all the way through. Many people, it is really fast. Some people, it's subtle. But the science behind this is so amazing. I've always been finance, always been, I guess you want to say, interested in so much of the research because I've always been a person that go to research seminars and this kind of thing. So it's you can't say enough about what it does. Everybody should be on it, all ages. It's just amazing because when you turn on the stem cells in the body, like you tell everybody, it just helps the body heal better all the way through. And of course, the biggest thing in our body, a lot of people don't understand, is priority of healing. Because when the body heals, it heals on what's going to be survival. So some people will use the patch and they get quick change. Some people use the patch and it takes a long time. And that's the reason, because the survival of the body is done by innate intelligence, which was God in it, and it's going to go to the spot that's going to survive. So I don't know what else I can tell other than it's a fantastic program. I'm thankful we found out about it. One story I tell, because my wife passed away 3 years ago after she fractured her hip. And of course, they had her on opioids and some other things happened at the hospital. Shouldn't have happened. But if we'd have had the pain patches and these kind of patches, I believe she'd be here today. So the seriousness of people getting LifeWave patches is so serious. It's life-saving. So life-enhancing and life-saving. So.
And you do stem cells in your clinic. You do PRP. So how is PRP, in your opinion, different than the stem cell activation patches? And do you use those together in clinic?
Yes. Well, the nurse practitioner does all that, but I help with the recommendations and so forth. But she does all the procedures and takes an exam and evaluation of them. But the PRP is where the nurse takes your blood and spins that down and concentrates it, which concentrates the stem cells. And the younger you are, the better that works. And of course, the older you get, the less that works. So that's PRP, and they inject it back into the joints and you get good relief, but it's more of a temporary thing. But younger people, it can be a longer lasting type thing. What we recommend, of course, if these joints are really bad, we recommend the stem cell that we put in, PRP, and then a complement that with the patching along with that. And that's the best way to go, depending on your age and so forth. We've got many, many people on the patches already that are improving and just with amazing. So we offer all of those things to our clients, and depending on what their condition they're in, what age they are, what their situation is. So we offer the best that we can do for them.
Are you wearing any other patches other than X39?
I wear the X39, the X49, the carcinogen for inflammation. I've done the I've done all of them, I guess, just to see how they work. And of course, my knee, I injured it the second time. I had hurt my knee when I was 12 or 13 really bad, and had troubles with it all through my life. And chiropractic's always helped it, therapy's always helped it. But I started the stem cell, really got good results. And of course, I had it the second time, and I still has improved But since I put the patch on, I could see just gradual general change in it and strengthen the whole system. So I've done them all. They all work. I want to tell a story about my mother-in-law. She's 98, and I sent her some of the pain patches, Ice Wave. And of course, she's on the other side of the country from me. And she indicated she was probably 40% better the first day. I mean, she walks with a cane, and she said she felt really good relief right away, which is amazing. So it's just amazing. I've used them all in combination just to try them out, see where I go. But the X39 and 49 is the main one you should wear, and just do it constantly, because time will change everything that's in the body, because it travels all through the body after it gets to reactivate those stem cells. As you say, it's amazing how a good Lord made the body to heal. This is what David has given us, is just amazing. I can't say enough about it.
It's so true. And let's talk a little bit about X49.
It is. It's amazing. Yes, because that's would be the reason I can lift more weights and do more extensive bike riding and these kind of things. It's just, and then more energy. It's